So what's the difference between cold and flu? The two words go together like salt and pepper, or like New Year's and weight loss. Well, I'm Dr. Alan Crane, and I want to help you figure out what the difference is. Most people have the general idea that they are different, but when pressed, have a hard time really saying what the difference is. The cold, the common cold, is something very common. You usually get on average 3 or more times during a year, and it is a virus that's primarily in the nose. A cold is focused in the nose. The 3 main symptoms of a cold are sneezing, nasal snuffiness, and runny nose. All are focused in the nose. You may have other symptoms. You may have a fever, 100, 101 maybe. You may have some tickling or scratchiness in the back of the throat. In fact, that may be the very first symptom, is a little scratch in the back of the throat. Then after a couple days, the nasal discharge tends to turn a little bit darker, greener. And then after about a week, you're all the way better. But it's focused in the head, focused in the nose. With the flu, you're sick all over. It's a whole body disease. It's a much more serious illness. The flu in the United States today still kills about 36,000 people a year, mostly people who already are weak for some reason or another, but it's a serious illness. And it usually slams into you with a fever. Typically the fever is in the 102 all the way up to 106 range, a higher fever, often the first symptom, and you feel sick all over. You have muscle aches, you're tired, you feel out of it, you really feel crummy. And after a couple of days, the respiratory symptoms start to come too. And depending where the flu virus settles, you might have some sneezing, you might have some coughing. The classic symptom is a dry, hacking kind of cough. Could be wheezing, could be other things, but the cough is the most common. Then it's there also for around 7 days or so. At the end of it, you may have another peak of fatigue and a second peak of fever, but usually after about a week, you'll start feeling better with most cases of the flu. Colds and flus are very, very different illnesses with a few of the same symptoms.